Good morning, everyone. This is my NGO video on the Trauma Treatment International facility. I will be covering this organization that is an organization that assists people who are affected by torture, trafficking, and slavery, much of what we have been learning about in trauma and recovery. The founders of Trauma Treatment International are Dr. Brock Chisholm, who has over 15 years' experience in psychological assessment and treatment of trauma survivors, Polly Rossdale, an independent human rights consultant specializing in asylum and human rights advocacy, research, and project coordination. Polly has management and international program development experience in the fields of resettlement, refugees, and torture survivors in the nonprofit sector. And lastly, there's Dr. Katie Rodgent, a consultant clinical psychologist specializing in the treatment of PTSD and other trauma-related disorders in asylum seekers, refugees, and victims of trafficking. So each of the founders are more than qualified for this job. One of their mottos is, "We're working for a world where everyone can get the support they need to stop past traumas from adversely defining their future." Most of the victims of trauma never get the help that they need, and it is the Trauma Treatment International's mission to change that and to make that difference in victims' lives. Dr. Brock Chisholm, one of the founders of Trauma Treatment International, says our work is used to inform and improve the wider political and social environment for victims, much of what they don't have. Victims can face lifetime struggles from traumatic events. In Judith Herman's Trauma and Recovery book, what we've been reading this semester, she discusses hyperarousal, intrusion, and constriction as lasting effects of trauma. Hyperarousal, like we have learned, is a type of physical response. Victims experiencing this cannot relax. Little can trigger the arousal or the anger that is felt with hyperarousal. And intrusion is when, even long after the danger occurs, the traumatic event is relived. This can be seen in nightmares, recurring memories, etc. This effect is very intrusive on one's life. Lastly is constriction. Constriction is very intrusive, like intrusion, and it is long-lasting. Victims feel a sort of surrender and dissociation. Victims feel numb and escape life when they experience constriction. If victims can't escape naturally, it is often that they rely upon drugs and alcohol, which leads them to withdraw from society and further their symptoms. These are the types of things that Trauma Treatment International is trying to help victims with. They try to rebuild the lives of victims. Trauma Treatment International believes that the best way to achieve large-scale improvements in trauma treatment is to work in partnership with organizations that support traumatized communities already. There are two ways that this is done: by filling the skills gaps in effective trauma treatment. They help build skills and deliver treatment where skills are not available. And secondly, they support organizations working with victims of trauma, strengthening the resilience, preventing and effectively responding to stress, and building the understanding of trauma. Some core values of TTI include, but are not limited to, compassion, working together, listening and changing, working within a human rights-based framework, and working in a knowledge-based network and practicing what they preach, which is very important. Their projects include trauma capacity building, which is working directly with human rights organizations to develop a tool which will support assessment, staff training, and organizational culture change to address the risks of working with trauma. Because when there's a staff member that doesn't understand how to train properly, that can either make or break someone's life. Another project includes improving trauma research. TTI actively seeks to document and share the learning and contribute to the evidence based around trauma treatment to ensure that even more victims of trafficking, torture, and war and slavery receive the most effective psychological support they need to recover. Lastly, they work to support victims, like stated on their website. They prefer to co-develop and build skills, but when the need is urgent and our partner has requested it, we can provide direct specialist psychological assistance to victims of trauma. The Trauma Treatment Institute works hard to aid in the recovery of trauma victims. This is a wonderful non-governmental organization that focuses on much of the